In our top story at this hour, 31 people have died in the last 2 months due to swine flu in Maharashtra's Nashik. 5 deaths have been reported in the last 48 hours. Advisories are being issued in schools and colleges to educate people about the symptoms of swine flu and how this can be avoided. Disha Shah reporting from Nashik. Disha, it's becoming a major cause of concern with more reports of the spread of swine flu coming in. Give us the latest situation, please. Well, we've lost the line with Disha, but we are reporting this morning that Nashik has now reported 31 instances of deaths due to swine flu. This within a period of 2 months. 5 deaths have happened in the last 48 hours alone. So clearly, this is a disease that is spreading fast, and in Nashik in particular, the figures are quite high. 5 deaths in 48 hours has become a major cause of concern. There are now advisories being issued in schools and colleges to educate people about the symptoms of swine flu and how they can stay safe. 31 people have died in the last 2 months due to swine flu in Maharashtra's Nashik. Remember, swine flu has struck several parts of Maharashtra. Nashik is, in fact, seems to be right now the epicenter. Swine flu is back to haunt the state, and 31 is the total number of figure that we are reporting this morning. This is a figure coming out of Maharashtra alone. We're trying to go across to our reporters to get an understanding of what are the measures being taken, because the immediate challenge as always is to restrict the spread of this disease and of course to create awareness among people on how they can stay safe. Over 750 people have already tested positive for swine flu in Maharashtra alone. That has become a major cause of concern, particularly because the death toll is now on the rise. 5 deaths reported within the last 48 hours in Nashik alone. And we are playing out those symptoms for you, which you can see there. High-grade fever, lethargy, lack of appetite. Those are the symptoms that you need to look out for. And also persistent cough and cold is also something that could be behind one of the symptoms rather of swine flu. Let me go across to Dr. Sanjeev Bagai, who is joining us right now on the broadcast. Dr. Sanjeev Bagai, at this point, the cause of concern is that the disease is spreading. The death toll has reached 31. Is enough being done to restrict this epidemic?
Yeah, actually the symptoms of, to begin with, actually swine flu, what we call as H1N1, is an influenza viral infection. It's exactly the same as a host of other influenza viruses and all other upper respiratory viruses. So it presents just with, to begin with a very transient cold and cough, and with low-grade fever, sore throat, headache, body ache, myalgia. And if it is H1N1 indeed, unfortunately, then it spreads. Right. It spreads from the throat to other body organs, and the patient very often goes into respiratory distress and cardiac compromise. There is practically nothing which differentiates this versus other viral infections. So if anyone has a cold and cough for more than at least 48 hours with high-grade fever or a hacking cough with vomiting or not feeling well, really the medical advisors don't self-medicate and definitely show to the local doctor. There is a test which is available which can pick up H1N1 infection quickly. Right. And what we really need is a lot of supportive treatment and isolation, because it is contagious.
Right. Supportive treatment, isolation, those are the measures that need to be taken immediately for those afflicted by swine flu. Dr. Bagai, thanks for joining us. Let me go across to Disha, who is in fact reporting on the cases of swine flu in Maharashtra. Disha, 31 is the total death toll. Now, over 750 have already tested positive. What is the ground situation?
Well, absolutely. After the year, we are talking about 31 deaths in less than 2 months, especially in the city of Nashik. This is the figure that we are getting. Apparently, in the last 48 hours, 5 lives have been lost only due to swine flu here in the city of Nashik alone. And Pune, on the other hand, has casualties of 30 deaths. So over and above, there have been 65 to 66 deaths reported only in the state of Maharashtra in the past 2 months. So this is the figure that we are getting from the state health department here. And there are several causes, and of course we heard the doctors telling us at this point in time. But what is more important and concerning is the fact, Afrida, that there are lack of isolation wards in most of the hospitals, be it in Pune or be it in Nashik or any other hospitals in the state of Maharashtra. And that's the reason people are not really getting admitted in one of the hospitals. They are being asked to move from one hospital to another, and that's the reason it's a lot of time consuming and people end up losing their lives. So isolation ward is very important if a swine flu patient wants to be treated and get admitted. So this is something that is very concerning, and the government has been promising over several months and years now that there will be isolation wards that will be set up only to treat swine flu patients. That's number one. And secondly, the most important testing kit, that's also not available in most of the city hospitals, and that's the reason people have to travel to a lot of, city areas. Not much of it is really available in the interiors, in the rural areas, and that's the reason they have to travel a lot of distance, and that again consumes a lot of time. So a lot of health and...
Right. Okay, so a lot of those healthcare centers, the primary healthcare centers, are ill-equipped with testing kits, as Disha is reporting. So that is something that the government must take immediate note of, because this is a disease that requires awareness. It is left to people now to exercise caution when it comes to these symptoms that we are playing out to you on your screens. Thanks for joining us, Disha.